Dr. Hochman, the medical matchmaker. As a family medicine physician and huge physician advocate, I help doctors to find the jobs of their dreams. Hi, this is Dr. Hochman, the medical matchmaker. I help doctors and physician-owned private practices match where doctors can really enjoy practicing medicine again. And today we have a very exciting guest. This is Dr. Gleaton. She's an obstetrician gynecologist in Charleston. And I'm going to actually hand over to Dr. Gleaton to introduce herself.
Yes, hello. I'm Dr. Gleaton, and I am in beautiful Charleston, South Carolina, and I am the owner and CEO of the Epicenter, which is a women's health practice where we focus on patient-centered care and excellence in service.
And Dr. Gleaton is so awesome. So I brought her on to tell her a little bit about her practice. And, you know, of course, please reach out if you're looking for a practice just like Dr. Gleaton's or Dr. Gleaton's practice. So I wanted to start out, tell me a little bit about what motivated you to start your practice and how that vision has really evolved over the years.
Absolutely. So I was in a hospital-owned practice as an employed doctor, and I really enjoyed my job. I loved my patients. I loved my partners. We had great camaraderie, but I really felt there was something missing when I looked at the elements that we provided for patient-centered care. One of my goals is to make a huge improvement in the maternal morbidity and mortality rates in the United States, and I felt somewhat limited in what I could do being in a hospital-owned practice. So while I loved the environment that I was in, I knew I would always be stunted and limited in my ability to make impact. And so at the end of the day, I sought God and I trusted Him, and I feel and I know I heard His voice, and I stepped out on my own and created my independent practice, the Epicenter, and it's been blissful from the day I started. So.
And I see you're standing in the practice. It is so beautiful. It looks like a spa there. Tell me a little bit about the environment. Like, what does it feel like working in that gorgeous spa?
Yes, well, you stated it correctly. We really provide a serene and peaceful and tranquil environment, and that's important to us. We know that our patients, many times they come and they have social determinants that affect their ability to receive care. Many times they have anxiety. They are nervous about their care, meeting a new provider. So our goal is to make them feel like family here at the Epicenter. And we really say, welcome to our Epic family. We basically provide all things nurturing. We are focused on their comfort and making sure that we provide compassionate care. That's our main thrust.
Oh, I really love that. And something that really stands out to me about your practice is when you and I were meeting the one day, your office manager jumped on the meeting before you did. And I don't know if I told you this. And so she, you know, I said, hey, what does it feel like to work in your practice? What does it feel like working for Dr. Gleaton? And she could not stop singing your praises. She says, we love working here. Everyone loves Dr. Gleaton. We all love each other. We just are like a real work family. And, you know, she really spoke so highly about the relationship that you have where you're not afraid to have those difficult conversations, and you're able to have them in a very open and understanding sort of way. And I think that just speaks volumes to, you know, the kind of practice owner that you are and the kind of place that it really is to work in.
Yeah, you're exactly right. Like, we are different, and we pride ourselves on being different from corporate medicine. We value mutual respect, and we want everyone to be heard, and we know that we can learn from one another. We are an all-female team, and we kind of just come together and we feel like family. And we know that we are here for a common mission. So if you're not about patient-centered care, excellence, and service, you don't belong here. And that's okay. We know our mission. We're very clear on our directives, and we make it happen. So my goal is to grow a world-class team while also growing a world-class practice.
That's so beautiful. What type of patient population does your practice serve?
We're a fairly diverse population. Of course, we are heavy in obstetrics. I sincerely love OBGYN. I think I'll love delivering babies until I retire and even beyond. I don't see myself wanting to give that up, although a lot of my colleagues similar in age have done so. But we really love providing patient-centered care. And I like to call it for OB family-centered care because I know like the opinions of the doula and the mother-in-law and the father of the baby and the lactation specialist, we all come together to provide that family-centered care to make sure that we are basically providing mission, but also respecting the autonomy of our patients for shared decision-making. I think that's most important. So,
well, thank you. As a mother and a family medicine physician, I can appreciate you and your, that type of practice so intensely. I just love my OB-GYN. I'm done having kids and I just still love her and I still want to go see her all the time. And I think,
yes.
Having that relationship throughout the pregnancy and it's a very vulnerable part of life. It's just so huge.
Absolutely. Especially for first-time moms. There's so many questions and concerns. And, I get lots of feedback about our visits because, like these are 10-minute visits typically, right? So folks have a ton of information from TikTok and Google and social media that they want to ask about and they want our opinions. And so we are so big into making sure that patients have adequate time to ask those questions. We basically are providing group prenatal care where it's a centering model where patients basically have a full 2 hours with their provider to kind of talk about any of these things. And so that's one of our major missions and drives. And so I think that's what distinguishes us from many other practices in the area.
That is so cool. And, it really helps you to build that community. A lot of, especially first-time moms, don't have other moms that they can lean on. And 2 hours, holy moly, that's awesome.
Mm-hmm. Yeah, and patients love it. It's a 98% satisfaction rate. It reduces maternal morbidity mortality in terms of reducing like preterm labor, preterm birth. Postpartum depression is less. Breastfeeding rates are higher. It's like the best model of care. So.
Oh, that's amazing. Something I hear about from physicians a lot, and I've been there, done that, is all the administrative burdens that we have as physicians, all the unnecessary paperwork and all of that. How does your practice handle that so that doctors can just be doctors and really focus on patient care?
I'm so glad you brought this up because this is a huge point for me in terms of when I came and left corporate medicine, I knew I could not continue the way I had continued in the past. I had 2 young boys, a 2-year-old and a 4-year-old, and I really spent every single weekend as well as every single evening completing patient charts. And it would be until 8 or 9 in the evening. And I realized that if I continued practicing medicine that way, 1, I would burn out. 2, I was really almost already burnt out. And 3, I realized that my sons would graduate from high school and not really know who their mom was. And they would say, gosh, you know what? I want to thank my grandmother and my dad and my grandfather. And then they'd be like, and my mom, where is she? And so I realized that I really had to stand up and make a difference in how I practice medicine because I own the place. And so for me, it's been a huge, huge, huge satisfier to be able to bring in scribes. And I really feel like every provider, every physician deserves a scribe. And here at the Epicenter, we make sure that that provision is available because we know that quality of life is just as important. You cannot show up your full self here if you are empty because you've been working all night. And so we make it a point to make sure scribes are available, they are adequately trained, and they are a great support to our providers.
That's amazing. Oh my gosh. That sounds like such a great place to work. And I love that you can be at work and enjoy the work and work when you're at work and be home when you're at home. Are there other things you do as far as work-life balance in your practice?
Yeah, so we understand that, like I said, we're all females, most of us are moms, and we understand that there are different stages of life in motherhood. And so we know that someone who just had a baby, breastfeeding, newborn, is going to have a completely different schedule than someone whose kids are in college. And so we have midwives and we have nurse practitioners and myself, and we all have different stages and different requirements for our schedules. So flexibility in scheduling is something I'm really proud to offer. I feel like in corporate medicine, you kind of have to provide a cookie cutter experience because you have so many providers. But here in a smaller practice where we can tailor make our schedules is really unique because I have some providers that are part-time, working 3 days a week, some who are 5 days a week. And the difference in being able to stagger arrival times and leaving times has been huge. And I think my team, they really appreciate that I support their home life because I know their home life will affect their performance here and what they can give to my patients.
Exactly. That is awesome. How else do you foster collaboration and teamwork among the medical staff and the physicians, and really make that a supportive working environment?
Yeah, so we want all of our teammates. First of all, we are very stringent in our process for hiring teammates. Like I said, you cannot have a world-class practice without a world-class team. And so we typically make sure that we interview thoroughly. But once you're a part of this team, we want to make sure that you're provided the resources and the tools that you need. So we are very open, and we encourage all of our teammates to speak up about things that they need to be more efficient. We look for opportunities for them to find better ways to do things. We basically look for practice savings, and we pass those savings on to the team as opposed to just keeping them to ourselves. And so we want them to feel like investors in this practice, like they own stock here, and they are rewarded for their creativity, their innovation, and basically that keeps them invested in our mission.
Do you have a long-term goal or long-term vision for your practice?
Yes, so I'm very excited to say, and this is something I kind of dreamt of when I was in corporate medicine, but I'm excited to say that we have been open for 2.5 years, and the second year of practice, we were nominated as the best OBGYN practice in Charleston. And that is so huge, and it might seem very trivial to some folks, but we really work hard, and I feel like the community said, we get it, we hear you, and we're glad that you're a part of our community. And that was just such a wake-up call for me. Like, you know what? People do notice when you do things different, when you take more time. And so ultimately, our goal is to expand the mission of the Epicenter to basically open more practices. We have just settled on a Somerville location, which is about maybe 20 minutes from our current location. We want to serve Greater Charleston and make sure that we make a difference in terms of outcomes, not just here in our main practice, but also in surrounding satellite locations. So we're just excited to grow, and to grow with meaning and purpose, not just to be big, but we want to grow because we want to expand and improve patient outcomes.
And I'll expand on that. I'll expand on your growth. You're growing and hiring, and so you're looking for a physician to join your group. And some of the cool things you're offering is, as you've spoken about, that schedule flexibility. And, a respectful environment and a supportive environment and the ability to leave work at work. There's so many unique things to your practice. And I thank you for giving that to physicians and showing physicians that medicine can be awesome again. A lot of the physicians I speak with are burned out or thinking about leaving medicine, not because of medicine, it's because of all these other things. And something I love about your practice is you've said, this is what I don't like about medicine. I'm going to create a practice that has none of that and all of what I love and what we went into medicine for, which is to take care of patients. And I just want to emphasize again your mission. Can you just speak one more time about your mission in your practice?
Absolutely. So here at the Epicenter, our goal is to basically provide women's health services in a comfortable, inviting environment where we encourage, we support, and we attend to the physical, emotional, and spiritual needs of patients. So that's our whole thrust and purpose. Without patients, we wouldn't be here. And so to do that, I have to have a functional team who is satisfied in their work-life balance, who feel fulfilled, who come to work full and not empty so that they can provide that mission or help accomplish that mission.
That's beautiful. And you've lived it and you've kind of proven it. And I think the fact that you're only 2.5 years in and you're hiring another physician is huge. So congratulations.
Thank you.
For anyone watching this who maybe is kind of at the end of their training journey, I'm curious if you could go back in time to your final year of training, what would you go back and tell yourself?
That was a long time ago. It's hard to remember that far back. But I think I would say, and I wish I knew this as a young graduating resident, that you do not have to travel the path that everyone else follows. Like, there is a road that's less traveled, and there is a way to be a trailblazer and to create your own path where your voice is heard, not only heard, but respected, and where you can basically go into medicine and impact, the culture of medicine, but also outcomes by having your voice heard and having your ideas acted upon and not sat on a shelf because there are thousands of other providers who have a different mission, and you can't honor all of those. So I think the beauty of considering a smaller private practice is that your voice will be heard, Your patients know, love, and respect you, and they expect to see you there. And it's just a great feeling of give and take. So I feel like I would tell myself, like, hey, don't follow the path that everyone else follows, because you might just find something beautiful and create a masterpiece.
Oh, I love that so much. Thank you for that. Well, you heard it, guys. Dr. Gleaton's practice is The Bomb, and she's hiring.
.com.
TheBomb.com. So, if you're interested in learning more about her, please reach out to me. My website is www.happydayhealth.co, or you can reach out to me here where you are watching this video, and I'd love to hear from you. And I'd love to introduce you to Dr. Gleaton as well. Thank you so much for joining us, and thank you for what you do. And I'm so grateful to know you, and I'm grateful for what you do for your patients and physicians, and for me, quite frankly. You give me kind of hope for the future of medicine.
No, thank you so much. And I appreciate your investing in practices who are looking to provide mission-aligned doctors and providers, because, it's really been difficult, trying to find the right recruiting company and someone who understands but cares about that mission and will make sure that you match-mate perfectly. So I appreciate you.
Oh, thank you so much. Okay, well, you heard it, guys. Let's reach out, let's chat. And if you know someone who you feel like really is burned out, please share this video with them. Let's show them that medicine can be awesome again, and you don't have to put up with the status quo.
Yes, come here. Yes.
Bye.
Thank you.